Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Patellar tendonitis or jumper's knee. The patellar tendon connects the kneecap, the patella, to the shinbone. This is part of the extensor mechanism of the knee. Together with the kneecap, quadriceps tendon, and the quadriceps muscle, these structures allow you to straighten your knee and provide strength for a kicking motion. The patellar tendon, like other tendons, is made of tough, fibrous bands of tissue. The tendon is surrounded by a vascular tissue lining that provides nutrition to the tendon. /r/n/r/n Patellar tendonitis occurs when the patellar tendon becomes inflamed and irritated. This problem is most often seen in athletes who do repetitive jumping. To reason patellar tendonitis is often called jumper's knee. Patellar tendonitis is most often seen in participants of sports such as basketball and volleyball, although it can also be seen in runners and other types of athletes. /r/n/r/n Patellar tendinosis is different from tendonitis in that it is a chronic condition. Instead of the tendon becoming inflamed and irritated, the condition is more gradual in development and characterized by microscopic tears and thickening of the tendon. Patellar tendinosis causes similar symptoms, but the treatment of this condition is different from that used for tendonitis. /r/n/r/n Partial patellar tendon tears, a finding sometimes described on an MRI, are usually characteristic of chronic patellar tendinosis. These tears are differentiated from a complete patellar tendon tear, in which the entire tendon is ruptured and requires surgical repair. /r/n/r/n Patellar tendonitis and tendinosis usually cause pain directly over the patellar tendon. In these cases, the tendon is usually tender and swollen. Movement of the knee may cause a crunching sensation called crepitus directly over the swollen tendon. The other common symptom of patellar tendon problems is pain with activities, especially jumping or kneeling. /r/n/r/n X-ray tests are usually performed to confirm there is no problem with the bones around the knee. Occasionally, a calcium deposit may be seen, particularly in patients with chronic patellar tendinosis. An MRI may be helpful to look for symptoms of inflammation or partial tears within the tendon. /r/n/r/n Treatment should be initiated once the proper diagnosis is confirmed by your healthcare provider. If the problem is acute inflammation, treatment may include the following. /r/n/r/n When the condition is chronic, treatment of inflammation is less likely to be helpful. The focus of treatment for patellar tendonitis and tendinosis is physical therapy. Eccentric exercises, in particular, may aid in treatment. /r/n/r/n Some surgeons are also using PRP injections for the treatment of patellar tendonitis and tendinosis. These injections may help stimulate a healing reaction in the body, although there haven't yet been many studies on whether this treatment is effective. /r/n/r/n On some occasions, patients have persistent patellar tendonitis symptoms despite the measures mentioned above. In patients with chronic patellar pain who have tried these treatments for an extended duration, surgery may be considered. Surgery is usually considered if the damaged tendon is seen on an MRI. During surgery, this damaged tendon can be repaired. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.